Even though this defect is present at birth, it may function adequately for years without causing symptoms, often until midlife. It's then that you may have complications of chest pain, fatigue, shortness of breath, to name a few symptoms. Approximately 2% of the population has a bicuspid aortic valve, making it the most common congenital heart condition. While there's no known cause, 25% will have inherited it from a family member who shares 50% of their genes, who also has the condition. And men are twice as likely as women to be born with this heart valve disease. Hi, my name is Carrie, and this is my personal experience with a bicuspid aortic valve. It was in 2007, during an annual checkup, my doctor discovered a heart murmur. It was different enough that he wanted to refer me to see a cardiologist. At the time, Red Deer Hospital didn't have any cardiologists on staff, so I was sent to Calgary to see Dr. Cohen. And after an echocardiogram, I was diagnosed with a bicuspid aortic valve. It's an abnormal aortic valve in the heart. A bicuspid aortic valve has only two small parts called leaflets instead of the normal three. It's the most common type of congenital heart disease. Even though a bicuspid valve is present at birth, doctors may not diagnose it until you become symptomatic. The first symptom that I had, and didn't realize until my regular checkup, was a heart murmur. My doctor heard this with a stethoscope. It's hard to listen to your own heart, but my husband has listened to it, and he says that the sound it makes is really quite fascinating. It's a thump, followed by a whoosh. In order to understand what was going on, I went to have an echocardiogram. An echocardiogram is an ultrasound test that checks the structure and function of your heart. It uses sound waves to create pictures of the heart. This common test can show blood flow through the heart and heart valves. Your healthcare provider can use the pictures from the test to find the heart disease or other heart conditions. The heart is a complex organ that works around the clock to keep oxygen-rich blood flowing through the body. One important way that the heart regulates blood movement is with its valves. A heart valve ensures that the blood moves in one direction through the heart. As blood passes from chamber to chamber, valves open to let it flow and then close to keep it from moving back into the chamber it just left. What we discovered was when my heart would pump blood through the heart, a third of that would return back into the valve as it was not closing as it should. Aortic regurgitation, or a leaky valve, is the inadequate closure of the aortic valve during the phase of the heartbeat when the heart muscles relaxes and allows the chambers to fill with blood that results in the reverse blood flow through the aortic valve. It allows some of the blood that was pumped out of the left ventricle to leak back in. And as the left ventricle works harder to keep pushing blood through the aortic valve, it may eventually become enlarged and weakened. And a weakened left ventricle may lead to heart failure. The challenge is that it can be years before a bicuspid aortic valve causes an issue. Once your valve does show signs of regurgitation, your heart is likely working harder to pump blood to the body. The extra work can lead to that heart failure. It's important to monitor a bicuspid valve so that any changes can be caught early and treated. So at the time I was in my early 30s, and the doctor wanted to monitor me regularly. So every year there would be a trip to Calgary. I would have a stress test, which shows how the heart works during physical activity. It's also sometimes called a stress exercise test. Exercise makes the heart pump harder and faster. A stress test can show problems with the blood flow within the heart. This test usually involves walking on a treadmill while a healthcare provider watches your heart rhythm, blood pressure, and breathing during the test. I would also have an echocardiogram every year and then an appointment with my cardiologist, Dr. Cohen. Every year, the doctor said that in the future I would need to have an operation to fix my bicuspid aortic valve, but that was 5 to 10 years away. When your heart initially compensates for that leaky aortic valve, you may not notice any symptoms. As the conditions worsen, though, the aortic regurgitation symptoms may include chest pain. You might feel discomfort and tightness that increases with physical activity. Fatigue. With increased activity, you may feel tired and weak. Shortness of breath. You may have a hard time breathing deeply, especially when lying down or after being active. Swollen ankles and feet. Swelling may occur when the flow of blood is disturbed. fainting or lightheadedness. You may feel dizzy or even lose consciousness during physical activity. Heart murmur. This is the abnormal heart sound that's heard through the stethoscope. Heart palpitations. You may feel sensations of a rapid, fluttering heartbeat. Approximately 80% of people with a bicuspid aortic valve eventually require a repair or replacement of the aortic valve. And aortic valve repair and replacement surgery replaces it through traditional open heart surgery. So it wasn't a case of if I would need the surgery, but when. Winter 2015, I started experiencing extreme pain in the chest. I first chalked it up to heartburn, but it wasn't going away. The only way I could get sleep was inclined in my lazy boy chair. I started to wonder if this pain was associated with the leaky valve. And after a few days of discomfort and the pain increasing, I was able to get an appointment at the clinic with my family doctor. I was scolded for trying to be tough and waiting too long. They ordered an ambulance and sent me to the hospital. So I was diagnosed with a heart infection called pericarditis. Once again, my husband got a call letting him know that I was going to the hospital with lights and sirens. Pericarditis may be caused by infection or autoimmune disorders or numerous other things. It's a swelling and irritation of the thin, sac-like tissue surrounding the heart, called the pericardium. Pericarditis often causes sharp chest pain, and the chest pain occurs when the irritated layers of the pericardium rub against each other. The fluid buildup can lead to further heart complications. A thickening and scarring of the heart lining changes prevent the heart from filling and emptying properly. In the emergency room, I was being treated for pain, but my heart condition left us waiting for recommendations from the on-call cardiologist. The cocktail of painkillers that I was on was enough to take down a large horse, but it only kept the edge off. I spent a couple of nights in emergency, and then the hospital was able to find a bed in a ward for me to rest more comfortably. I was the youngest patient by a generation in the cardiac unit. A week later, the infection had left and the pain was managed, and I was able to return home. 9 years I had made the bi-yearly trip to Calgary, but the trip in the spring of 2016, monitoring my heart, indicated a different story. The infection caused damage, and I was told that open heart surgery would be in the next couple of years for a valve replacement instead of the standard 5 to 10 years, which I've been told forever. I received a call from Dr. Cohen himself, my cardiologist, a month later. He thought that I might be a candidate for a specialized surgery that's performed in Canada by only one surgeon, who's the top in the country and practiced out of Toronto. I was a candidate because my valve was bad, but not too bad. I was in good health and under the age of 40. I turned 39 that summer. He asked permission to send a referral to Dr. David, the surgeon operating out of the Toronto General Hospital. I have to admit my eyes welled up with tears, as this meant that the life-saving surgery was now in the planning stages. I will tell you the rest of my heart story in the next video, as this video has gotten too long already. I hope that you've learned more about bicuspid aortic valves, aortic regurgitation, leaky valve, and the tests used to find this heart disease. If you enjoyed this video, don't forget to give it a thumbs up. And if you're enjoying the content that I'm trying to put out on my YouTube channel, I'd love for you to subscribe. I'm always hopeful that I can find a kindred spirit and that you want to be part of this community. I appreciate your patience as I continue to learn and grow in my YouTube journey. I enjoy the learning and growth that does come and that I'm experiencing as I continue to grow this channel. I also want to give a huge thank you to all of my subscribers. I'm really grateful and I appreciate your support. And with that all, I will see you next week with the rest of my story.